I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to go over how should I sleep. This is a very big question I get asked a lot. So I know we've done this topic before, but I get asked this on a daily basis. Which sleeping postures are good, which are bad, which should you avoid, different things like that. So tonight we're going to go over how should you sleep. So there really is kind of one definitive answer on how you should sleep. And that is not on your stomach. Basically, everything else is fair game, all right? But you absolutely, if you are a stomach sleeper, and I understand the people who sleep on their stomach are very loyal to stomach sleeping, and they get very upset when I try and change it, and they tell me there's no way they can change it, and they refuse to change it. But if you are a stomach sleeper, and if you are experiencing neck pain, back pain, shoulder pain, get off your stomach. And we're going to go over why and go over how you should be sleeping. So when you go to sleep, obviously, the idea is that you rejuvenate your body, that fluid is allowed to flow in, flow out of spaces. So when you sleep on your stomach is going to you're going to be forced to turn your head to the side. So you're already going to start to jam up your neck, all right? You're going to generally start to turn your thoracic spine, which is your mid-back spine, and you're going to have to turn your low back spine in one direction or another in order to be able to breathe while you sleep. So that starts a process where you are putting your muscles in elongated positions. Some are shortened, some are longer. But it's not a healthy position to sleep in all night because it doesn't allow your muscles to rest. It doesn't allow them to go to sleep. It also doesn't create healthy bone interaction. So when you turn your head to the side, you're starting to create some bone-on-bone interaction or some rubbing a little bit. And you want to make sure that you are not doing that. You want to make sure when you're sleeping that you're giving your body maximum time to rejuvenate. So you want to put it in the best possible position. A lot of times, you hear people say, I was sore yesterday, I got a really good night's sleep, and now I feel great. And there's a lot of validity to that. If you sleep correctly and you sleep in the right position, you can actually rejuvenate an injury overnight. You should be able to repair it yourself overnight. So how should you sleep? So let's say you're someone who sleeps on their back, all right? So if you are a back sleeper, and here's my pathetic drawing, okay? So what you want to do is you want to make sure that, first of all, you have a pillow that just fills the curve of your neck. You do not have to buy a fancy pillow. I don't own a fancy pillow. My pillow is $20 from Kohl's. I get sent fancy pillows. I send them back. I don't want them. Literally, you just have to make sure that the curve in your neck right here, that your pillow is able to fill that. You don't want a down pillow. You don't want a pillow that compresses as soon as you lay down. Otherwise, it's going to flatten out and you're going to wind up scrunching your shoulders to replace the pillow, or you're going to wind up sleeping like this. And again, if you wind up with your head back a little bit in some extension, you're going to wind up compressing some blood, some muscle, some nerve, instead of allowing all of that to be open and in neutral and rejuvenating during the night. You're going to be stuck like this. So just be careful of that pillow in the back. It does not, like I said, have to be anything fancy. It just really has to fill the gap. And then for your back, you're just going to lay flat on your back. Now, this is the trick to laying on your back, is you want your knees to be elevated. Now, I know a lot of people that when I tell them to elevate their knees will put a pillow underneath their knees. Well, what happens through the night is that pillow from your weight will just flatten out. So you wind up sleeping and you're only getting about this much bend in your knees because you put your legs on top of your pillow and it winds up flattening the pillow out. What you want to do is you want to make sure that there is 4, 5, 6 pillows. So you're up like this, okay? So your legs are really elevated and you're able to maintain a nice, good, neutral posture in your back when you sleep, okay? If your knees are just like this, all you're going to do is just compress the pillows by the end of the night. Your back's probably going to be sore because it's going to wind up compressing your spine because your knees aren't up. You have to bring your knees up enough to get your pelvis to kind of go back a little bit. All right, so if you sleep on your back, that's the big thing, is that your knees are up at this angle. The higher, the better. All right, so you're not going to fail on going too high. You will fail if your knees are like this and the pillows get smushed. So you do want to be cognizant of that. If you're suffering from shoulder pain and you're sleeping on your back, what you can do is you can put pillows underneath your arms. Okay, that'll bring your shoulders up and a little bit more forward. That will facilitate an increased blood flow into your shoulders, helping the healing process. I understand that's a lot of pillows, so it's not always a perfect thing to do. And honestly, if you don't have shoulder pain and when you lay down on your back, your shoulders don't get sore, there's no real need to do it. That's just for someone who is suffering some sort of shoulder pain and you want to get a little bit more blood flow. You can take 2 pillows and just kind of stuff them behind your back or behind both your arms. So that way your arms are elevated, but your neck is still in neutral. And then for side is perfectly fine to sleep on. Just requires a little bit more setup in order to be able to sleep on your side. So when you sleep on your side, the pillow's a little bit different, and they make side sleeper pillows. They are nothing fancy, okay? So don't go buy a $100 side sleeper pillow. It is not necessary. Find the cheapest one because you're going to replace it a bunch of times. So what you need to do is you need to find a side sleeper pillow that covers this gap. Now I'm going to tell you that side sleeper pillows are not comfortable. They are not one of those pillows that you sink your head into like a down pillow. You'll be like, oh my gosh, this is comfortable. It's literally, your head's going to be like thunk, and it's not going to go anywhere. And for the first few nights, you're going to be like, this is not comfortable. But what it's designed to do is that it needs to fill this gap in here. Now I, being an ex-swimmer, have larger shoulders, so I have a larger gap to fill. Most people don't have to worry about this, so they can get a smaller size side sleeper pillow. But when you lay on your side, what most oftentimes happens without a side sleeper pillow is you're going to wind up scrunching like this. If you wake up with headaches, if you suffer with headaches during the day, if you wind up with shoulder pain, if you wake up with a stiff neck, it's because you've brought your shoulder on top, your pillow on top of your shoulder, and you're trying to scrunch it up. So you're trying to sleep like this, and you're trying to use your shoulder as a pillow as opposed to just going to buy a side sleeper pillow. So really important that this be covered. And do not use 2 pillows in order to cover this gap. All right? What happens is during the night, one pillow slides, and then again, you're winding up scrunching and trying to use your muscles and trying to get that pillow correct and trying to use your shoulder to help support your head. So very important when you sleep on your side to have that pillow that's firm, very firm. It's going to take you some nights to get used to, yes, but it will make a huge difference in the long run. That covers this area so you aren't scrunching. Just doing that and demonstrating that makes my neck hurt. So imagine doing that all night. And you're doing it subconsciously because your head just wants to rest. So some of you are doing it consciously because you're awake and you're trying to just make yourself comfortable. But, a lot of times you're doing it subconsciously and then you wake up and you're like, oh, my neck, it's so stiff, it's so sore. It's because you've done this all night. Or the other popular thing to do is instead of scrunching, you'll just let your shoulder lean forward like this. And what you're going to do is you're actually going to cut off your blood supply. So you're going to limit your blood supply into your shoulder. So again, you might wake up and you're like, oh, my shoulder is really achy. It's because you slept on your side, and what you did to get your head to the pillow is moved your shoulder to the side. So now you have rotation in your shoulder. You have your shoulder coming forward, so some of the blood flow is being compressed. And then you have this pillow, and you have your head that's trying to reach it. So now this side's being jammed together, this side's being opened up, and your shoulder is being, the blood flow is being diminished. So you're going to wake up with a stiff neck and a sore shoulder. So on your side, when you're sleeping, the must is a pillow that says side sleeper pillow that fills this gap. The second thing that you want to do is you want to make sure that you have a pillow. I was going to bring it in for the video, but I forgot it. Just pillow between your knees. It doesn't have to be anything special. All right, just a simple pillow, so that way your knees, your hips don't come in. Okay, you're not trying to Roll so your knees don't rub together. A lot of people have pressure points on the inside of their knees, so it's uncomfortable if they sleep like this, and then they wind up dropping a leg, which means you rotate your hip, which means everything from the bottom rotates. When the bottom starts to rotate, it means you're going to jam up your spine. So again, if you wake up and you're like, oh, I got a sore low back, that's why. It's because you're dropping your knee off, your hip goes, and so on and so forth. So sleeping on your side, you want a pillow. They make really long pillows, body pillows that you can hug it so it can go in between your shoulders, in between your knees, and in between your ankles. Not as important as a side sleeper pillow for your head, but equally as important. When you think about sleeping at night, you want to think about everything being straight. So your head, neck, and lower body should all be straight. If you find yourself rotating your head, you're twisting your body, you are not in the right position. And the sleeping on your side does get a little tricky because of the fact that when you sleep on your side, you can kind of drop and you can rotate. Well, Dr. Moore, I sleep and I have no idea what I do. I get it. But if you set yourself up correctly, your body will eventually learn to stay in that position. I guarantee you, you will spend months where you are kicking pillows out of bed and maybe not waking up in the right position, but your body fell asleep in that position, and at least for a little bit it was rejuvenated, and it will learn to go and stay and sleep in that position if you make it comfortable enough. If you don't, if you're laying like this and your knees are jammed together and your pressure points are rubbing, your body's going to get out of that within 2 seconds. You're not going to last very long. But if you make yourself comfortable, then you will be able to stay there as long as you can. Stomach, we're not even going to talk about because you need to stay off your stomach. You cannot jam up your neck and everything else. Yes, they do make stomach sleeper pillows where you can have your neck and everything in perfect alignment. If you are able to sleep with your face in a hole, okay, because you are a stomach sleeper, then get the pillow and sleep like that. That's totally fine. I do not know anybody that I've ever met that's been able to sleep with those pillows, and I'm sure there are people out there, but that is the only acceptable way to sleep when you are sleeping on your stomach. Another thing I want to talk about with sleep is surgery. So we see a lot of post-surgical patient knees and shoulders especially. My word of advice is go get a recliner. It is very, very, very important that you have a recliner to sleep in. You will not be able to lay flat in your bed in either post-surgery of your knee or of your shoulder. It's going to be really tough. So you want to make sure that you have a recliner, even if you don't like them, even if it doesn't fit in your decor, you want to make sure that you have a recliner to support your shoulders and your knees. It is extremely important. If you are suffering from surgery and you're not sleeping, your body's not recovering, you're not making gains as much as you can, you want to make sure that you are getting that recliner so you are able to sleep in it. If you have access to one, sleep in a recliner. Mattresses, that's kind of the last topic I want to touch on is mattresses. So are the Sleep Number beds, are the Tempur-Pedic beds worth it? Yes. Are they ridiculously expensive? Yes. Should you buy one if you could afford one? Absolutely. When I say Tempur-Pedic, I'm talking about the brand Tempur-Pedic, not Tempur-Pedic by Serta, or everybody's got their own little Tempur-Pedic line. I'm talking about the brand Tempur-Pedic. Tempur-Pedic and Sleep Number are absolutely expensive, but they do work. When you look for a mattress, you want to look for a slightly firm mattress. Okay? You don't want a pillow top. You don't want anything that's super soft. You want to make sure that you are looking for something that contours your body as best you can. The more expensive the bed, the more expensive the mattress, the better it's going to contour your body. If your mattress is over 10 years old and it's a mattress that didn't come with a lifetime warranty and guaranteed for life, get rid of it. It is done. And you are causing yourself back pain, shoulder pain, low back pain, neck pain by continuing to sleep in it. If you're splitting hairs and you're like, I don't know if my mattress is causing you pain, it is. Okay, so really be aware. Mattresses do play a big role in you being able to get into the correct posture and you being able to sleep correctly and not wake up with back pain, neck pain, whatever pain you wake up with.